Hi everybody, this is Michelle from Virtual Hand Care, your online hand expert. In this video, I want to show you how to apply a shoulder sling all by yourself. So what I usually recommend is that you have your sling placed on something a little bit higher than like a table, like perhaps a countertop, a higher table, or maybe a shelf or a dresser that is a little bit higher. That way you're not having to lift your arm up too high, but you also don't have to lean down too low to where that might be a little bit uncomfortable on your shoulder after your surgery. I have a sling here without an abductor pillow. So for my particular surgery, I had a lipoma excision off of my clavicle. So I don't necessarily have any kind of real specific restrictions like I would have with a rotator cuff repair or a labrum repair or perhaps a humeral fracture, whatever the case may be. Some types of shoulder surgeries have very specific protocols, and you may have to have a abductor pillow, which is the pillow that sits more on the hip to keep the arm out to the side. But for this particular video, I'm going to show you how to just put on a sling for the shoulder without the abductor pillow. So what you're going to do is you're going to make sure that everything is unbuckled first. This is how I like to do it. And what you want to do is you want to make sure that you just kind of slide the sling onto the arm. So see, I haven't had to move my arm at all. And you can place your body accordingly to what's comfortable for you and within your restrictions. So for this video though, I'm going to be facing towards you, where I might be facing towards the sling a little bit more if I was doing this by myself. So I slide the sling up underneath my arm here, and I want to make sure that my elbow is seated all the way back into the sling. And then what I like to do is I like to actually close the sling up here with, usually there's a Velcro piece that fits over the top of the forearm just to kind of cinch that together. And then I like to place the piece around my hand or my thumb if you need that piece for comfort. And then what you want to do is you want to take the strap that is going to go up and over your arm, and then you want to buckle the first piece, and then you can come and buckle the second clip here. And then you can adjust as needed. And there you have it. You can move this up or down, whatever is comfortable for you. Then to remove it, you would do the same thing, just in the opposite direction. So you would rest your arm on the table or on the pillow. So again, you're not having to lift your arm out to the side. And then you would unbuckle one at a time. And remove the strap. And then you can remove the other straps as well around the hand. And the good thing about these straps is that they usually have Velcro on both sides, so you don't need to remove the whole entire strap. So I would just remove one side. And you now have this nice and open so that then you could lift your arm out of the sling. And then you can just slide this off to the side, and perhaps you can do your exercises as instructed by your doctor or your therapist. Now, some people don't want to have to fuss with all the straps and the clips here. However, I do recommend that you at least remove the clips, because what you don't want to be doing is you don't want to be lifting this strap up and overhead, because that really is going to cause you to be moving the shoulder a little bit too much. So I would recommend to just rest the arm down and use your other hand or have somebody assist you so that you can remove the clips and the Velcro and take your sling off safely, because you don't want to be moving in a way that you're not supposed to, so that you can heal and recover faster from your surgery. Let me know in the comments below if that helped you, and like this video, and don't forget to hit that subscribe button below. Thanks for watching.